This presentation is set out in 4 parts. In the first part, we look at what multiple sclerosis or MS is and how it affects your body. The second part investigates the different types of treatments that are available for your specific condition and features interviews with specialists giving up-to-date information on treatments. Part 3 focuses on injection and treatment-related side effects, giving advice on how to deal with them. And finally, we look to the future and how those affected by MS are managing their condition. If you have any questions at any time, please ask your nurse or doctor. MS is a disorder of the central nervous system, affecting an estimated 85,000 people in the UK and 6,000 in Ireland. MS can take different forms. The most common is relapsing remitting, with around 80% of MS patients experiencing this first. It is characterised by clearly defined relapses or attacks, with periods of complete or partial recovery. People with this form of MS have been shown to benefit from treatment with a disease-modifying therapy. Around half of patients with the relapsing remitting form develop secondary progressive MS within 10 years from onset. These patients can benefit from treatment with a disease-modifying therapy if they're still experiencing relapses. So how does MS affect your body? The central nervous system is made up of the brain and spinal cord, and these transmit information to the rest of the body as a series of electrical impulses along nerve fibres. Everything you feel, do, smell, taste, hear or see is controlled by these electrical impulses. So the system acts as a kind of computer that keeps us in touch with the world around us. The nerve fibres are encased in a sheath made up of a protein called myelin. This protects and insulates the nerves, allowing the electrical impulses to be sent more quickly. In people affected by MS, their immune system, which normally defends against foreign bodies, such as viruses, actually attacks multiple areas of their central nervous system. Areas of the brain and spinal cord become inflamed, which causes damage to the myelin sheath in a process called demyelination. Hard areas called plaques, also known as lesions or scars, develop around the damaged nerves. So how does this affect your everyday life? Loss of the myelin sheath results in a slowing down of the electrical impulses, and the damage may even stop the impulses. The exact symptoms depend on which nerves are affected and to what extent they are damaged. Common symptoms include areas of numbness and weakness of movement. MS is a long-term condition, and its initial diagnosis can be both confusing and life-changing. When David and Simone were given a diagnosis of MS, their initial worries were the driving force that made them focus on their quality of life.
When I was first diagnosed, it was a real shock. It was having my life turned upside down. It was the unknown, the fear of the unknown. It was not only the effect on my relationships with my husband and wider family. I had a child already, but whether I would have another baby.
When I was first diagnosed, obviously I was extremely upset, but this didn't last for very long. I had a few phone calls to friends and family just to chat it over, and realised that I needed a positive outlook on life with MS, and I was going to just enjoy myself as much as I could while I could.
I think also before David was diagnosed, we were so fortunate and we had nothing to complain about. And obviously the diagnosis came as a huge shock, but it put everything into its proper place, and trivial things are now so unimportant.
I decided to go ahead and have another baby, and I was absolutely fine. When I was diagnosed, my initial reaction was to find out as much information about the disease. I joined the MS Society, researched stuff on the internet, also got books from libraries. And subsequently I've written articles for the MS Society. The other way I cope is I was part-time when I was diagnosed, and I intended to return to work full-time when my children were at school. But what I've done is I actually remain part-time, and I'm off on a Friday, and that helps me recuperate from the week at work, so it gives me the balance. I'm still able to work, yet I can still enjoy my weekends with my family.
Ongoing scientific research has meant that we now understand much more about the condition of MS than ever before. This has led to advances in both diagnosis and treatment. Professor David Bates is a neurologist who specialises in the condition of MS.
Multiple sclerosis used to be diagnosed on the basis of more than one clinical attack or relapse occurring in different parts of the body over the space of time. But during the late 1990s, we recognised that multiple sclerosis could be diagnosed even when the first attack occurred. And the new criteria, the MacDonald criteria, are designed essentially to allow us to make an earlier diagnosis of multiple sclerosis. To do that, they rely heavily upon the MRI scan, and they allow us to take information from the scan when the patient presents with an initial symptom. In the normal brain, there are no scars. In the patient who has multiple sclerosis, however, there are several differences. The most apparent is that within the white matter of the brain, there are areas of high signal, again appearing white, which are scars and which represent the damage that occurs to the brain and causes the symptoms for the individual patient. During the past 15 years, the MRI scan has become the main way in which we make the diagnosis of multiple sclerosis. Simone and David both have relapsing remitting multiple sclerosis which has been present for years and caused them relapses. Some of those relapses have been severe, and fortunately they've made good recoveries. But they're both aware of the risk of further relapses in the future, and they've both been told about disease-modifying therapy. And after considerable thought, they've both decided that they wish to take disease-modifying therapy in the long term.